Okay, class, we were talking about the salivary glands last time, and I had to end because my video was running out. But we said that the parasympathetic turns it on, rest and recluse. And we had the otic ganglion from cranial nerve 9 going to the parotids, and then 7 going to the submandibular and sublingual. Acetylcholine turns it on. Norepinephrine from the superior cervical, ganglion turns them off. So in surgery, when we get ready to do general surgery, we're going to put you to sleep. We don't want you to aspirate your secretions, your salivary secretions. So we'll give you an anticholinergic like atropine. Atropine would dry up the secretions. All right. Let's go further. Okay, so salivary functions: cleanses the mouth, moistens dissolved food chemicals, aids in bolus formation, contains enzymes that break down starch. You have a salivary amylase for your starches, that's like your glycogens and so forth, or your and you have a salivary lipase for your lips. So in the saliva, you have some enzymes. We'll do that a little later as we run through digestion. The parotid gland, we already said, that's the one. Let's just go to a picture. Here's that parotid gland right here. That's the one that mumps affects. It empties around that second molar, upper. Right there. Submandibular, 7, median. Duct opens at the frenulum. Let's go to that picture again. Let's be sure we're all on the same page. We won't rush. We'll make sure. Right there. There's that labial frenulum, that lingual frenulum, I should say. That lingual frenulum right there. Okay. And then the sublingual kind of does 10 to 12. It's right all up in there. Let's go here. Side view does better on that. Where is that? Right here. See several of them coming in on that sublingual under the tongue. So we've seen this. Won't do that. We already talked about the nerves coming into those glands. Saliva secreted by serous and mucus cells. Okay. Serous is watery. Okay. So the parotid does mainly serous. Watery. Serous cells produce a watery containing enzymes, ions, and tiny bit of mucin. That's this. Solution. Mucus cells produce mucin, which is a glycoprotein, and when mixed with water produces mucus. The more water, the less viscous. The parotid gland has serous. That means it's the one doing a lot of enzymes and ions. Submandibular kind of and buccal. Now you do have some. Remember, just in the cheeks and so forth. The buccal glands, and they secrete more of an equal serous and mucus. And then the sublingual glands, the ones that do a bunch of ducts, they secrete really mucus. Okay. Go further. Composition of saliva. Most of it's water. You got your electrolytes. You got your amylase. Amylase breaks down the starches. When we do digestion, we'll look at the enzymes that all the way down. And then the lipase. Then mucin we talked about. Also you have water-soluble waste, urea. Urea is the breakdown of your amino acids if you're going to use them for something else besides protein, and uric acid breakdown of your nitrogenous bases. Lysozyme we talked about in the immune system. Lysozyme is an antibiotic type of thing. Then IgA, here we are, IgA in secretions. We talked about the defensins, so forth. Additional data. Now what we have, we can do saliva tests for HIV antibodies. These are some new things that they can do. We're trying to get least invasive. Let me put it like this. Trying to get less invasive in this medicine thing. Checking for oral cancer and diabetes also can be done. Okay. Now, diabetes, because of the fact if your blood sugar is high, it increases osmotic pressure pulling water in. So a person with a high blood sugar sometimes can know it because the mouth will get dry, because it'll pull water from the mouth too. So you'll have a dry mouth with you'll have that dried mucin. Okay. Normal flora in the mouth convert food-derived nitrates. So in the mouth, you do have some normal flora. Okay. Control of salivation. We talked about the salivary glands produce secretions. The intrinsic glands continuously keep the mouth moist. Now, the intrinsic glands are the ones, again, in the cheeks and everywhere. The extrinsic ones are the ones outside. That would be the parotid, submandibular, sublingual. Extrinsic produce secretions when ingested food stimulates chemoreceptors and mechanoreceptors. In other words, the food just being there. But what's the chemical composition? Chemos activate most strongly by acids like vinegar and citrus. Mechano is stimulated by an object in the mouth. So in other words, it doesn't even have to be food. If you put a marble in your mouth, it'll do it. Sight or smell of food is enough. Now remember, you're also working with the olfactory nerve. Irritations of lower GI by bacterial, spicy, or hyper, especially, will give you that nausea, that increased salivation, because it's trying to come on back up. You feel that nauseated feeling, and then your mouth will start getting, I'm sure all of you experienced that. Some of this, just living, Salivatory nuclei, we already talked about that. That's the nuclei that come in and do the parotids and so forth. Strong sympathetic stimulation, already said it, inhibits salivation. Xerostomia. Xerostomia is a fancy name for a dry mouth. And it can get so dry, it can start causing ulcerations in the mouth. Okay, you see right here, I put a picture in of the dry mouth, that xerostomia can even cause ulcerations. Average output of saliva is about 1 liter to 1.5 liters a day. Okay. So now we go to the teeth. Let's talk briefly about the teeth. Some of you may be going into dental hygiene. I don't know. So when we look at the teeth, let's go down here. There we are. 20, those are the baby teeth, deciduous teeth. Deciduous means they shed out. Primary formed by age 21, primary and permanent. 32 permanent teeth, all except the third molars. That's the ones in the way at the back end, erupt by adolescence. Those are ones, a lot of times your mouth is too small to have these. You have to take them out. I know I did. I had to take mine out. Okay, so let's go further. All right. So here's kind of an x-ray, deciduous. You see how those permanent teeth push the deciduous out? They come in and just push them out. Sometimes they hang around and you have to have braces and everything. Again, I had to have that. Okay. So then we look at the classes of teeth. The incisors, which are those ones in the front, right there, they kind of chisel your food. Then the canine teeth, if you want to call them the Dracula teeth, they kind of tear at the food. And then you have the premolars and the molars. Those are the ones that they are hard. They give you a good biting pressure there. Sometimes you ought to look up biting pressures. I did one time, looking at how many pounds per square feet the hippopotamus, the alligator, the crocodile. We don't really have that kind of that force that those things do. Those animals do. But it's interesting. Look up biting pressure sometimes. It'd be interesting to see which animal has the strongest biting pressures. Okay. There you are. There's the teeth again. Here's kind of the dental formula you can look at. 2 incisors. This is on one side of the mouth. 2 molars. Permanent teeth, that's primary. Permanent, 2 incisors, 1 cuspid, 2 premolars, 3 molars. That's on that one side, that's 1/2. So then you'd have the other half. Okay. Tooth structure, let's just look at that real quick. Here's the tooth structure. Here's the root. That's the alveolar socket, AP1. There's that canal, that root canal. See, that's where the blood vessels and nerves are coming in. So we have a root canal, which is kind of painful, that try to open up so you can save that tooth. That's called a root canal. Now, you have the enamel. That's that right there. Amelioblast do the enamel. And once the enamel is laid down, they die. And so enamel can't be replaced. The dentin, odontoblasts do the dentin. Now dentin is, okay, the hardest structure that you got in the body is enamel. It's harder than bone. And the reason is, go back, check my bone videos. It's got these hydroxyapatite crystals. Bone does too, but it has more of them. That's the hard part of bone right there. That's that hard part. It's got more than that. But the only thing about the enamel, if it wears off, it's not going to come back. The dentin is kind of like bone. It's got living cells up in there. It's got living cells, just like you have with osteoblast. And the cells that do that are called the odontoblast. And they do this here. And they keep doing it throughout your life until, you mess your tooth up with having a poor root canal. Okay. So this right here is called the alveolar socket. And remember, it's a gomphosis, peg and socket joint. And you have this alveolar ligament, periodontal ligament is what I want to say. Periodontal ligament. Right there. Anchoring that tooth in. Okay, that's the gingival surface right there. Gingival surface right there. Okay, that's the neck of your tooth. The root is under the bone. Here's the crown of the tooth. Okay, let's go a little further. All right. Now something I did not do, and I'm trying to find it here. Our saliva, tongue. I want to go back now and do the taste buds, because there was so I'm going to go to a video now called Taste in a moment. Taste. Remember when we did the tongue right here? That was the tongue. We did the tongue. And we talked about the various taste buds and everything. So now I want to go. See, here it is. Go to my taste PowerPoint. I'm going to go to that in just a second here. Taste PowerPoint. Okay, but I'm going to go on down and finish this. So we did tooth structure. The cementum is here, right in there. What it's doing is that cementum is anchoring the periodontal ligament to the tooth. That's cementum. The periodontal ligament to the tooth. Okay. Gomphosis. Okay. We talked about the tooth structure. Pulp cavity. That pulp cavity, that's where you have all the blood vessels and everything. Okay. There's that. Dental caries, you know what that is. Dental cavities. Dental plaque. Now we know that this also can affect what? The heart. I mentioned that in my heart, that dental caries can affect the heart. Okay, gingivitis, you know about that. You can look at it. All right. gum infection, in other words.